The Smith & Nephew Biceptor Tenodesis system was created to provide a simplified procedure for biceps tenodesis. The Biceptor Tenodesis system does not require whip stitching of the tendon, which means fewer steps for a mini-open or all-arthroscopic repair. The result is a strong repair featuring the BioSure PK interference screw. Create standard arthroscopic portals in which a diagnostic arthroscopy is performed. This includes a posterior soft spot portal and sometimes a lateral portal. Shown here is a rotator interval anterior portal. Insert a spinal needle at the anterolateral edge of the acromion into the shoulder joint just anterior to the supraspinatus tendon and through the biceps. Introduce a monofilament suture through the needle and biceps tendon. Using a grasper, retrieve one limb of suture out the anterior interval portal. Remove the spinal needle. Accessing the joint through the anterior interval portal, use a basket punch or arthroscopic scissors to cut the long head of the biceps tendon at its insertion point onto the labrum. Debride any biceps stump that remains. Retrieve the remaining arm of suture so that both arms exit the interval portal. Make a 4 cm incision at the superior aspect of the axillary fold laterally along the medial edge of the biceps muscle. Carry the incision through the subcutaneous tissue to expose the inferior muscular border of the pectoralis major muscle. Just deep and inferior to the pectoralis, the short head biceps muscle belly is identified. Place a pointed Holman retractor under the pectoralis muscle and over the lateral border of the humerus, providing superior and lateral retraction of the pectoralis muscle. Place a small Holman retractor along the medial aspect of the humerus to pull the short head of the biceps medial and to define the medial edge of the bone. This will also protect the medial structures. Care should be taken to avoid excessive medial retraction, which may place the musculocutaneous nerve at risk. At this point, the long head biceps tendon can be palpated just medial to the pectoralis tendon insertion on the humeral shaft. Using a curved hemostat, the tendon sheath is opened and the tendon is removed from the sheath and brought to the side or out into the wound to allow access to the underlying humeral bone. Drill the 2.4 mm guide wire perpendicularly to the humeral shaft in the desired location in the bicipital groove. The tendon fork can be used as a drill guide for placing the 2.4 mm drill pin. Keep the 2.4 mm guide wire in place and ream over with the appropriately sized endoscopic drill XL to a depth of 20 mm. Use line-to-line sizing. For example, use an 8.0 mm endoscopic drill for an 8.0 mm interference screw. Using the proximal sutures, tension the biceps tendon to return the long head of the biceps to the desired tension. At this point, it is important to release tension on the biceps tendon. Capture the tendon with the tendon fork. Insert into the drilled hole until the tendon reaches the far cortex. Important note: when pushing the biceps tendon into the prepared hole, release tension on the biceps tendon to allow it to easily slide into the hole. Insert the 1.5 mm tendon pin through the cannulation on the tendon fork. Attach the bi-grip pin puller on the back of the tendon pin and mallet the pin until it bottoms out on the handle of the tendon fork. Remove the bi-grip pin puller and the tendon fork, leaving the 1.5 mm tendon pin in place. Place the BioSure PK interference screw onto the Biceptor driver and insert over the 1.5 mm tendon pin. Screw in until fully inserted. Remove the driver and the 1.5 mm tendon pin. Reattach the bi-grip pin puller to the end of the tendon pin if you need assistance in removing the tendon pin. Trim excess tendon.